So let's get started with introductions, and I'll call your names if you want to say your name, what university you're with, and what profession you're studying to be in. So why don't we start with Justin?
Yeah, hi everyone. Thank you for being here tonight. My name is Justin. I'm a fourth year pharmacy student at Southern Illinois University, Edwardsville.
Great. And how about Brittany?
I'm Brittany. I'm a second year graduate student at St. Louis University, and I'm studying speech pathology. Great.
And Tate?
Hi, everyone. I'm a second year dental student at the Missouri School of Dentistry and Oral Health in Kirksville and St. Louis.
Great. And B?
Hi, I'm a third year physical therapy student here at SLU.
Great. Well, welcome students, and now we'll start with the judges. Why don't we start with John?
So you guys know me, I'm John Morley, I'm a geriatrician at SLU.
And how about Jim next?
Hi, everybody. I'm Jim Pacala. I'm a geriatrician and the head of family medicine and community health at the University of Minnesota.
And we'll do Joe next.
Hi, everyone. I'm Joe Gogler. I'm a professor in the School of Public Health at the University of Minnesota.
And Marla?
Hi, Marla Bergwager from St. Louis University, obviously with my background there. And I'm in the School of Social Work, and I direct the Geriatric Education Center in the School of Medicine.
And Max?
Hi, everyone. Max Subatsky. I'm program director in medical family therapy here on SLU at the North Campus. Good to see all of you.
And I'm Chris Talley. I'm one of the judges. I'm in the School of Nursing and the University of Minnesota. I'm also a geriatric nurse practitioner. We also have on here Teresa Schicker, who is our program director, who is helping us run all the behind the scenes operations. We also have Sarah Engstrom on here, who's helping with the Zoom recording and the Zoom functioning. So we thank them for their help. So with that, we will let the team get started with their presentation. So I'll let Teresa and Sarah guide you through that, but you should be able to share your screen and then speak as you need.
Yeah, so I wanted to check which of you, oh, Justin, you're going to be sharing screen. Okay, great. We've got that set then. Wonderful. I will set the timer. Go ahead and start.
All right, good evening. We're happy to be here for the 2021 Interprofessional Geriatric Case Competition. So to start, I just want to go over a basic outline of what we will be going over this evening. So initially, we will go over a patient overview. And this is about Miss Lopez, her family, and some of the challenges that she and her family face. And then we will move into Miss Lopez's healthcare providers, and we will touch upon some of the roles that each of those providers will play to help Miss Lopez get to be where she wants to be physically, mentally, and emotionally. Then we will move into the plan of care. And this is broken down into Miss Lopez's immediate needs and long-term needs. And then we will go into each one of those. And lastly, we will wrap it up with the conclusion at the end. Now I want to introduce you to Miss Lopez. Miss Lopez is a 75-year-old female. She moved to the United States about 5 years ago after her husband died suddenly from a heart attack. This move allowed her to be closer to family for support, and so they could help take care of her. Currently, Miss Lopez does not have legal immigration status in the United States. She is independent, proud, and very social. She loves to be around family and friends, and those are some of the things that are most valuable to her. Miss Lopez did work as a house cleaner with some of her very close friends, and she did help with her grandchildren's daycare so her son and daughter-in-law could go to work. However, 3 months ago, she tested positive for COVID-19. And since then, she has lost energy and has had to stop cleaning and tending the grandkids. Eventually, she would like to return to both of those things as they bring a lot of purpose and happiness into her life. Now I will introduce you to some of Miss Lopez's family. Miss Lopez has a son named Mateo who works at a local food processing plant. He got COVID at work and had mild symptoms, but he feels guilty about bringing it home and infecting Miss Lopez. Mateo is married to Amelia. Amelia works afternoons and evenings at a local restaurant. Mateo and Amelia have 3 children that Miss Lopez would tend. This allowed Mateo and Amelia to go about their evenings and to work to bring income for the family. However, with the diagnosis of COVID-19, Miss Lopez has had to stop tending those children because of her lack of energy. Miss Lopez also has a daughter that is a registered nurse that lives 3 hours away in an urban area with her husband and their 2 teenage daughters. Once again, Miss Lopez has not seen this family for some time because of fear of spreading COVID-19 to them. She does not want to harm them in any way or cause them any inconvenience.
Okay, so now going into a brief case overview. As Tate has explained earlier, Miss Lopez did test positive for COVID-19 about 3 months ago, and she felt that she could just recover at home, so she didn't seek any treatment for it. So as a result, along with a lot of other healthcare factors, she experiences fatigue, low energy, some headaches, as well as some body aches. And she has also had some falls, 2 of them actually, within the last month, as well as losing 12 pounds in the last 3 months due to her poor appetite. And currently, she lives in a small rural agricultural community, and her diagnosed problems include type 2 diabetes, high blood pressure, and then class 2 obesity due to her BMI of 31.8. So we'd like to get into integrating her own personal goals as well as her healthcare team's goals. So up here we have Miss Lopez and her personal goal, which is to return to working part-time and provide after-school care for her grandchildren. And to support her personal goal, we have her family in the second tier. So her family members' goals include to improve her Miss Lopez's health so she can live comfortably and spend time with her family in a safe manner. And then finally, to support both her family and Miss Lopez herself, we have the healthcare team's goals. And many of these goals include improving her overall health and well-being and quality of life, as well as educating her on why the healthcare team is there and how we're there to support them, as well as education on the COVID vaccine and making sure that she understands and forming that mutual understanding with her and her family, as well as communicating properly across the team, as well as her family members. So going more into Miss Lopez's team. So we have Miss Lopez here in the middle, and in her inner circle, her support system, we have her family. We want to make sure that her family is integrated very heavily and very closely with her care process. So her family will be with Miss Lopez every step of the way through each step of the care process. And around the family, we have the care team. So we have pharmacists, we have dietitians, we have nurses, psychiatrists, social work, PT, OT, everyone else who will be there to support both the family and Miss Lopez, making sure that everyone is communicating at all of the team meetings and that they are getting the care that Miss Lopez needs. We would also like to dive into some of the barriers. So Miss Lopez does have quite a few barriers coming as an undocumented immigrant to the US and having limited English proficiency. And one thing that we did want to mention is her immigration status. So since she is undocumented, as Tate explained earlier, she doesn't have any of those benefits to insurances or healthcare access. So getting her immigration status can be a very difficult thing. And if we dive too deep into her immigration status, that can lead to deportation, which is actually the last thing that we want to do. So her family and her healthcare team are going to try to walk around these barriers and help Miss Lopez traverse across these barriers as best as we can.
So as Justin just explained, Miss Lopez has many barriers that she is up against, both physically, mentally, and with her undocumented status that she is trying to overcome. We thought it would be so important that she has resources that she could rely on for her physical and mental health needs, and also with her finances and any other challenges that she may face. We thought it would be very important that she has a nurse case manager assigned to help her. The nurse case manager could help her with her medications. Not only will it help Miss Lopez to understand her medications better, but the nurse case manager could also speak with the pharmacist and the primary care physician, so everybody is on the same page, and so everyone knows where Miss Lopez is on her road to better health. We also thought the nurse case manager could help with her limited energy. The nurse case manager could be in touch with the physical therapist, the dietitian, to speak about how she can use her energy in the best ways and how she can increase her energy. Lastly, the nurse case manager could also help with triage and help Miss Lopez understand where she needs to go next for her healthcare needs. Another great resource for Miss Lopez that we thought about would be her daughter, who is a nurse. If Lopez needed to turn to a family member, her daughter would be a great resource to help calm fears and to help her understand steps that healthcare providers are taking to improve Miss Lopez's life. And then also another important aspect we thought would be a social worker. The social worker can help in many ways. A social worker can help to navigate the healthcare system so she knows where she's at and where she needs to go from there. The social worker also helps keep the family in the loop. If there is anything that Miss Lopez doesn't understand or the family, the social worker can help to answer those questions and to get everyone on the same page. Another great benefit of a social worker is that they could possibly help with any financial challenges that Miss Lopez or the family may be facing.
So as an interprofessional team, we plan on communicating via weekly team meetings, using pagers, and also including the family during group meetings, as well as providing family education. As a team, it is everyone's role to place the patient at the center of care. We must share equal responsibility, collaborate, and share ideas, as well as being timely and punctual.
Another big thing that we went over was the FQHC. An FQHC benefits Miss Lopez in so many ways. And the awesome thing is Miss Lopez is already set up with an FQHC. At this location, Miss Lopez can have many health concerns addressed. She will have access to primary care, nursing, dentistry, a pharmacist, physical therapy, a dietitian, and a social worker, along with other healthcare providers as needed. Another great thing about the FQHC is that she can receive care and treatment there that she deserves, even though she does not have legal immigration status at the time being. Finances have been quite tight for Miss Lopez, and she will pay on a sliding scale, which is something that is so important. Another great thing about an FQHC is that referrals can be made quickly and efficiently. Because there are so many healthcare providers in one location, great interprofessional communication is done there, and this helps meet the needs of Miss Lopez and her family.
We decided to organize our plan of care into immediate needs and long-term needs. We believe that the FQHC that Ms. Lopez has access to is also a great tool and resource because, as Tate previously mentioned, the FQHC highlights many professions that she can seek treatment from. Ms. Lopez also has had a lack of energy and overall fatigue contributing to her well-being. We feel like addressing her diet, mobility, and physical activity levels can help improve these factors and ultimately help her reach her goals. Our long-term needs include social interaction, so getting Ms. Lopez back to being able to visit her coworkers and friends at work and visiting and taking care of her family. Improving her mental health, Ms. Lopez is a proud, independent social woman who is now dealing with emotional distress, so we want to make sure she's seen someone to help with her mental well-being. We believe that vaccine education is an important factor to include because Ms. Lopez had and still has COVID, and we want to ensure that she is taking all safety precautions so she doesn't get future illness and spread the disease. Ms. Lopez's daughter, who is a nurse, has the COVID vaccine, so we will suggest that she talk to her mom and brother, Mateo, about the effectiveness of the vaccine and how it is safe. We believe additional areas to address are dentistry, speech and language, and overall symptom management to ensure Ms. Lopez is receiving all aspects of care to help reach her goals. We think that financial stability and legal stability are also big factors in her care, as her monthly income is very low and she does not have any credit working towards or qualifying her for Medicare or Social Security. So now we're going to go into our first immediate need, Ms. Lopez's nutrition. So prior to COVID, Ms. Lopez demonstrated healthy eating habits that focused on a balanced traditional Mexican diet, as well as a normal appetite. She did, however, feel like her teeth were loose. Post-COVID, her appetite has been poor. She has lost her taste and smell, which may make eating less enjoyable. She has also been fatigued, which impacts her ability to cook and buy groceries. However, she does have access to a meal delivery system, Meals on Wheels. As a team, we believe it is important to educate Ms. Lopez on finding ways to make sure she is getting enough calories, protein, and nutrients throughout her day. This can include eating small meals throughout the day, drinking protein drinks, or taking multivitamins. We also know that people who are infected with COVID are at a greater risk for heart disease or stroke because it affects the inner surfaces of veins and arteries, which can cause blood vessel inflammation and blood clots, which compromise blood flow to the heart. Ms. Lopez has low HDL levels, which is the good cholesterol, and high LDL, which is bad cholesterol. So we'd want to educate her on limiting her intake of saturated fats like lard to help monitor these levels. We would also educate on regular dental exams and oral hygiene instructions. So on the next slide, here we have a couple of resources for Ms. Lopez that highlight what to expect after having COVID and what she can do to help manage any possible symptoms. And so then next, going into our next immediate need is focusing on Ms. Lopez's mobility and overall physical function. She has a gait speed of 0.625 meters per second, which puts her at a limited community ambulator speed, which means she is at an increased risk for falls, as well as her 2-minute walking test distance is well below her age peer norms. We want to do a progressive exercise program focusing on gait, speed, endurance, balance, and stability, as well as incorporating a fall prevention program. We believe that education and management of headaches and body aches can help with her overall well-being and mental health, and that education and energy conservation can help improve Ms. Lopez's fatigue. So going more into fall prevention, here are some pamphlets from the CDC on ways to prevent falls. So this can be another resource to Ms. Lopez, especially since here on the left is a pamphlet in Spanish to allow for easier translation. And then for our fall prevention program, we plan on incorporating the family throughout her care. We will suggest that they attend PT or OT to learn how to help their mom, Ms. Lopez, and how to do her exercises to be there to support her and express any concerns or questions. If the family cannot attend PT or OT, we can suggest filming on someone's phone so that the family still has access to what was done and can reach out to us as needed. We will educate on making environmental modifications and have the family come in to help her to her home with these modifications. So some of these modifications could include removing things she could trip over, like rugs, books, clothes, or shoes from the stairs and any place where she would be walking. To make sure there is no spread of COVID, Ms. Lopez's family made sure to get a COVID test and all tested negative, as well as we wear proper PPE.
Okay, so to dive deeper into some of more of Ms. Lopez's immediate needs, we'd like to take a look at some of her other lab work. So taking a look at the CBC, we can see that the hemoglobin and her hematocrits are low, and this can be contributing to her low energy and her fatigue. We'd also like to look at the BMP where her sodium is high. And as B had mentioned, we can use lifestyle modifications and dietary modifications to help lower that sodium by changing her diet. And another thing that I'd like to point out is her blood pressure. So we can see that her sitting blood pressure is currently 154/92. And when Ms. Lopez goes to a standing, her blood pressure drops down to 122/70. So this is actually indicative of orthostatic hypotension. And this is very dangerous especially for our elderly patients because it can increase her risk for falls. And just as B has mentioned, we'd like to get Ms. Lopez enrolled in fall prevention programs just to reduce her risk in falls, especially since she has had 2 falls within the last month. And then her hemoglobin A1C related to her type 2 diabetes is also currently elevated, as our current goal is wanting to get her below 7. So these are just some of the lab works that we'd like to point out and that are pertinent to her overall health and well-being. So I'd also like to touch upon some of the medications that Ms. Lopez is taking. She is currently on glipizide 5 milligrams by mouth daily for her diabetes, and then hydrochlorothiazide 25 milligrams by mouth daily. So how can pharmacy help to improve Ms. Lopez's quality of life through her medications? We definitely be, as pharmacists, communicating heavily with her nurse case manager, as well as her primary care doctor, as well as her social care worker and her family, in trying to change these medications to better her overall health. One thing that we can do is change over her glipizide over to metformin. Metformin is actually the first-line treatment for diabetes, and it's also a very cheap medication. Glipizide is a medication that can actually cause hemolytic anemia, which can be causing those low blood levels that we were talking about earlier on the last slide. So changing her over to a metformin may be more beneficial for Ms. Lopez. And then in terms of the orthostatic hypotension, hydrochlorothiazide, which is a diuretic, can actually be causing that orthostatic hypotension or be contributing to it. So either lowering that dose to either 12.5 or even getting rid of that hydrochlorothiazide and switching it over to another medication can be more beneficial. And of course, we'd like to make sure that her family is okay with these changes that we'd like to make, as well as her doctor and her nurse case manager. We'd also like to talk with Ms. Lopez about overall at-home health maintenance, such as daily blood pressure readings at home, as well as making sure that she's checking her blood sugar levels with a monitor daily as well.
Now we will move into Ms. Lopez's long-term needs. One very important aspect of this was that we wanted to improve Ms. Lopez's quality of life. Ms. Lopez scored an 11 on the Patient Health Questionnaire, which is a tool used for diagnosing and monitoring depression. A score of 11 puts her in the moderate depression range. Ms. Lopez has had many challenges that have caused more severe depression. She lost her husband suddenly, and losing a close loved one and that companionship can take a toll on just about anybody. Also, COVID-19 has caused her to be separated from her family. Instead of spending time with family, she has spent more time alone at her house, away from family and friends. Another thing that has caused isolation in her life is that she has stopped her cleaning job and she does not see her close friends anymore. Her family and her job were two things that she really looked forward to and she enjoyed being a part of. With the loss of her job and no longer tending her grandchildren, she has lost part of her identity and her purpose, which can be challenging for anyone, no matter their age or circumstance.
And as Tate briefly discussed, in aims to improve Ms. Lopez's quality of life, we will incorporate a team approach throughout her care. The speech pathologist will conduct a motivational interview and collaborate with the other team members to ensure we're all on board with helping Ms. Lopez achieve what she wants. Motivational interviewing helps ensure autonomy, relatedness, and competency by helping her explore and resolve doubt in her plan of care. Questions include, but not limited to, what are Ms. Lopez's interests or hobbies, and does she currently use any strategies to help herself, and what are they? Our goal right now is to help her envision a future where she participates in meaningful activities, and asking Ms. Lopez if this is something she wants to pursue as part of her plan of care is very important. The scales of cognitive and communicative ability for neurorehabilitation will be administered to figure out what areas of attention, memory, or visuospatial skills are impaired. We know there are many functional areas to memory, for example, short-term, long-term, episodic, procedural memory. And there are also many areas of attention, including focused, sustained, selective, divided. Therefore, pinpointing these areas will help us formulate SMART goals and capitalize on her strengths in order to promote those successful interventions. We want to all collaborate effectively on these results to figure out how the whole team can target her goals effectively. So in those weekly team meetings we discussed earlier, we will consider timing of services for each profession, because we don't want to intervene when Ms. Lopez is too fatigued. For example, cognitive communication therapy from the speech pathologist after occupational therapy will not be appropriate because Ms. Lopez might have very low energy during that time, which will not set her up for a success in therapy. And as a team, we decided virtual support groups are important to address her social isolation and loneliness. We want to emphasize social interactions and stimulation to avoid declines in the cognitive ability she currently presents with. And an interpreter may be considered depending on which virtual support group she participates in. For instance, Circle of Friends in St. Louis is a group rehabilitation model for older people who experience loneliness from time to time, and the aim is to alleviate and prevent this feeling. Other options are, of course, available as well, including cognitive stimulation therapy, which is an evidence-based practice focusing on improving cognition in patients with mild to moderate dementia. We would like Ms. Lopez to participate in a group with emphasis on client-centered goals and one that facilitates positive energy and discusses coping strategies amongst each other as a group of individuals that might be going through similar challenges or situations. We also wanted to include an activity Ms. Lopez can engage in with her grandchildren. Here you'll see a personal interest visual aid or even a memory book that her grandchildren can help her with by creating a page of themselves. Ms. Lopez's page can include a list of her favorite activities and hobbies to discuss those with unfamiliar communication partners. She may use this as a resource to fall back on if she finds herself having difficulty participating in those meaningful conversations in those support groups I mentioned earlier. And another option while considering Ms. Lopez's minimal access to healthcare are smartphone apps. This app specifically allows speech, language, and cognitive therapy exercises anytime and anywhere. Constant Therapy creates a customized program that will be tailored to her recovery goals, including targeting those areas of weaknesses to improve or help maintain her cognitive functioning.
And like we mentioned in our plan of care, we'd like to educate Ms. Lopez throughout this care plan process. And one of those education aspects is on vaccines. So Ms. Lopez did express disinterest in getting vaccines, as she feels that they currently make her sick whenever she gets a vaccine. And vaccine education is something that is easy to do, and a lot of healthcare professionals can help Ms. Lopez understand the meaning of vaccines and why they are there to help us. So her nurse case manager, social work can even help with vaccine education, pharmacists, her doctor. So there's a variety of healthcare professionals, as well as her family, since her daughter is a nurse, that can help her get educated on vaccines and the importance of them. And this is one of the educations that everyone can do, is vaccines do's versus vaccine don'ts. And there's a lot of misconceptions on vaccines and what they contain. But one thing that we want to make sure that Ms. Lopez knows is that vaccines are there to protect us, and they go through rigorous clinical trials in order to go through the safety and efficacy just to establish their safety, as well as the side effects. So knowing that vaccines can cause side effects, but they usually go away within a few days. And that vaccines also don't cause any autism, or things like how vaccines don't overload the immune system and how they don't contain any harmful substances such as mercury. So this is just something simple that all of her healthcare professionals can do, as well as her family. And Ms. Lopez can also access some free resources on vaccine education from the CDC. There's plenty of resources out there that we can show her in order to collectively get that mutual understanding with Ms. Lopez, so that she becomes familiar with what vaccines are. And we also want to make sure that she is as comfortable as we can get her and on board before we administer any vaccines. So we want to make sure that the team communication is important throughout as well.
So in conclusion, we learned a lot from this case study. We learned that geriatric cases can be very complex. Many factors go into formulating a thorough and effective plan of care, and that the patient, Ms. Lopez, and her goals need to be at the center of the plan of care. We learned that getting the family members heavily involved in the care process is also important to increase adherence and understanding. Some things that went well was that we saw viewpoints from different healthcare professionals, and everyone was very respectful of each other and their professions. However, some things that were difficult included finding time to meet due to our busy schedules and losing one of our team members. So that was one less perspective and healthcare professional to help with this case. But overall, we had lots of fun and it was great working with each other.
Well, thank you so much for that great presentation. If you want, you can take your slides down, and we'll open the floor for questions from the judges.
I can start.
Sure.
If one or more of you would like to respond to this, what, as it relates to the case, what were the challenges that you kind of identified as being the most significant?
That is a very good question. Thank you for asking that. I think one of the challenges that the four of us saw in Ms. Lopez's case was her being an undocumented immigrant and her being of low income. So in healthcare professionals, we naturally would want to care for our patients. But the healthcare system currently in the United States is extremely costly, and it's very financially burdening for a lot of our patients. So the fact that Ms. Lopez doesn't have immigration status, she doesn't have, as I said in the presentation, she doesn't have any access to insurance such as Medicaid. She's not eligible for that. So she has to go on the sliding pay scale that Tate has mentioned. So I think that was one of the most challenging aspects in terms of Ms. Lopez's case, is the financial burden that she has, because medications cost money, doctor visits cost money, so almost everything costs money. So it was really difficult trying to figure out a way to go around that and help to care for Ms. Lopez without putting on too much of a financial burden.
Good, thank you for that. I just, before I let my colleagues take over, great job. Thank you so much for doing this. You really, really focused on patient-centered care, and I just really commend you for that. That was a strong, strong theme throughout. So, thank you.
Well, I'll jump in here. I agree with Marla. I thought it was fantastic presentation, and I really congratulate your team and your analysis of the case. I just thought it was terrific. I really liked the way you distilled the goals of care to two simple things. One was, that she could return to work and that she could care for her grandkids. And that pyramid image that you used, I thought was very effective. If I could offer a little bit of criticism, I think it would have been great for you in each of your care plans elements to relate them back to how that would end up helping her return to work. How linking the strategy with actually satisfying the patient goal. I loved the way that you mentioned all the things that the FQHC could provide, including legal stability. One of our clinics in our department got a grant to have a lawyer present in one of our clinics in an area of high need twice a week. And for the first year of that grant, we got 180 referrals from our providers in that clinic. 70% of them, by the way, were about housing. Which was, illustrates the importance of just stable housing. So really great job on that. One of my questions was, you used a lot of patient support strategies. There were pamphlets, apps. You mentioned a couple of different apps, the virtual support group, and I kept wondering through all of those, how you would address language barrier and health literacy. That was a concern that I had. So if one of you could, did you folks talk about that? And what would be some ways that you'd be able to overcome those barriers of language and health literacy in using all of those different strategies that you mentioned?
Yeah, so I can kind of start on this. I know I had a few of the pamphlets on my slides, and actually one of the pamphlets was in Spanish.
Yeah, I saw that. Yeah.
Yeah. Thank you. But there are other pamphlets on the CDC that are in Spanish, but then throughout our care, we plan on just really simplifying how we speak, getting access to a translator, or using family members to help with communication as well.
Yeah, I think another really important thing, especially with the health literacy, especially since she's like 75 years old, I feel like, that generation, probably understands things differently than, her kids and healthcare providers and things like that. And so I think it would be so important to check for understanding, after we explain something, do you understand what we're trying to get across to you? Does the family understand? And we all work together so we're getting you to where we want, or Miss Lopez where we want her to be, basically.
Well,
And
thanks.
actually,
Oh,
oh, sorry,
go
I
ahead.
can actually add something that I found really cool from a pharmacy perspective. And so I've worked and been in a few pharmacies, including my work and across my clinical rotations. And something that I found that was really cool was Spanish is one of the more common languages that is spoken in the United States. So something that pharmacies have done is they've actually included some automatic like Spanish translations for some of the medications, because there's quite a few patients that I've seen in certain pharmacies that have a higher Spanish population, Spanish speaking population. And in order to accommodate for that, they've actually integrated this automatic translation for those more common medications into the system, the pharmacy systems that they use. I anticipate that being more and more common as the years go by, but this is just something new that I've been seeing going around some pharmacies. So I thought that was very cool and something that can also help and benefit with this specific case from a pharmacy standpoint.
Thanks so much.
I'll ask a question. So going through this process as an interprofessional team, what was something surprising that you found out about the approach of another team member that maybe you hadn't thought about using that approach to help solve a problem for Ms. Lopez? So I know we've got a physical therapist on the team, a pharmacist, who got a mix of disciplines. Was there something surprising that you learned about another discipline?
I can start with that. That's a really good question. And, I'm just trying to, I guess, gather my thoughts here a little bit. But especially coming from like a dental perspective, and then, learning about, the pharmacy side of things and, speech pathology and the physical therapy aspect. I feel like we all had different experiences, just from our education and from our learning that all kind of came together as we were focusing upon Miss Lopez, because she had so many different healthcare needs, but in order to meet all those needs, we all had to kind of go back from the experiences that we've had or things that we've learned and kind of implement them and then see how they all fit together in order to, treat her the best way, and even like we don't have a nurse in our group, but we were kind of thinking, how could a nurse case manager, play a role, just to kind of get that communication between like the primary care physician and, and other things that she might, not be clear about. And so it was just cool to see I guess, the different viewpoints that each one had and the experiences that each of us have had and how they all kind of, lined up in order to help us, I guess, have a good treatment plan for Miss Lopez.
I definitely found, so one specific thing was, in pharmacy school, they actually teach us a lot about like the diagnosis aspect, and all throughout, like when they were teaching us that, I'm thinking to myself, like, why would pharmacists need to know like such things like diagnosis? Isn't that what doctors are supposed to do? And then I also saw, like when Brittany was coming in, I saw that she shared one of her like educational pamphlets, stuff like that. And it was talking about how speech pathologists can use like certain tools to sort of like diagnose or like rate a patient's cognitive behavioral health. And I never realized that like speech pathologists can sort of be almost like a doctor in trying to like diagnose using a measuring tool in terms of cognitive and behavioral health. And so that kind of just made me realize there's all these different professions who are learning similar things. And this is beneficial to the patient, in my opinion, because we as healthcare professionals are there to provide care for the patient. And if we know how to, like how the diagnosing works for a patient, then this patient will have multiple barriers to prevent them from getting like falling into this pit of where no one knows what to do with this patient. So I thought it was really cool that when Brittany was sharing that piece of information that speech pathologists are able to use those tools as well, that doctors also use. So.
Great. So we have a couple minutes left. Is there any other question from another judge?
So maybe I could bring one thing up, Tay. I was interested that you thought that she was 75 and would be health illiterate, which she may or may not be, and that basically she couldn't understand much of what you guys understand, being young and bright. So I'm nearly 76. So I found that a little ageist. Okay, I think you guys are wonderful. Okay, so let's recognize that. But I think you need to be careful when you're looking at people because they're very different. I mean, we have a president who you may or may not like, who is nearly 80, floating around, who I think thinks he's most probably more literate than any of us. And previous president was my age, so he's 75. So I think it's very common when you're young to think, well, you know everything, and old people don't. And half the time you're right, and half the time you're wrong, But it's sort of somewhat offensive to a 75, not to me, because I think I'm old and stupid. So, but for most 75-year-olds, they don't want to hear that sort of comment or that get the feeling you feel that about them. And, a lot of the people you're going to deal with are going to be older people. And you've just got to be able to recognize that's why the speech therapy tests are so good, because it tells you whether the person can or can't think. You need to know what their education was like. You need to know whether they've still got a job or stuff. And when you've got that, you can put it all together and then make a decision of whether or not the person can do the things you want them to do or not do. And health literacy requires huge amounts of knowledge about what the person knows and how they can handle information. It's most probably, I think, the hardest job. So I don't do it. I leave it to the social worker or somebody else to go out there and work on the health literacy, because it's a very important part we need to know, but it's very hard to know what different older people are liable to do. Very much like if you looked at the four of you, and if you were honest, I'm sure one of you thinks you were so superior to the other three that couldn't understand why you had to work with them, because that's sort of natural for your age. I'm teasing you a little, but you've got to recognize that that's, I think, important not to be ageist. But I absolutely love you. I think you're phenomenal. So I'm just telling you that so that you won't tell me that I'm old and stupid and illiterate, all of which may be true.
Thank you for that point. I'm sorry if I offended anyone, but yeah, no, I completely agree with that 100%.
Yeah, you could have offended as me, and I am totally impossible to offend, to be honest. So don't worry.
All right. Well, we're at time. So I really want to thank the team. You did an excellent job with your presentation, and we will let you go. And then us judges will do our ratings. Thank you.
Let me just add to that.
Yes.
That you will be hearing from somebody at SLU about the prize money that you will receive as a result of winning at the local level. So just stay tuned for that. You should hear hopefully tomorrow about that, as well as you'll hear about the outcome of this tomorrow. And thank you. Thank you for representing SLU.
Yes,
Great job.
Thank you.
great job.
Thanks, everyone.
Okay, Teresa, what are our marching orders now?
Okay, well, take your notes, review what